Hello, hello, guys. It is nine. This is the class for 9-3. This class is being recorded. It is not live today, but this is chapter 2, and we're starting at section 1. So hopefully, all of you have been able to engage your Cengage products. I think I've mentioned before, I'll be using Cengage products from now on. So I do suggest that you buy it for the year. And several of you have emailed me, and I don't know what it looks like from a student point of view. So that's why I've given you the number of Cengage directly, and they can talk you through how to get to and how to answer the questions in the class. And again, so the classes will be this way for the future. So let's hopefully we can get used to it. And in the end, it's supposed to be a little bit cheaper. So first of all, we're going to talk about human reproduction. I find it a lot funny because a lot of my students do not know actually how babies are born. So they know how the sperm leaves the penis and enters into the vagina, but actually don't know what happens once inside the woman's body. So let me just show you. Let me pull up a picture. I usually write it on the whiteboard when I'm in the classroom. And remember, I am an expert artist, right? I'm amazing at that. Not. Okay, let's see if it'll let me. There we go. Okay, so you should see my board. You see I'm an expert artist. Yay me, right? Okay, so many people just don't realize what it actual happens. Most of the time, the last time you had any kind of basic biology was in high school, and you probably didn't pay a whole lot of attention there. Okay. So as you can so tell, my wonderful drawing. So this is the woman's uterus. This is where the baby is born. Okay, where the baby is, where it grows and develops inside mom's utero. Okay, so what happens is, there is a release of sperm, and there are thousands of sperm swimming and swimming and swimming and trying to get there, trying to get there, trying to get there, right? So mom ovulates. So she ovulates. So the when we are born, we have the most eggs. So females have the most eggs. So every time you have a menstruation, you lose eggs that are not fertilized, right? So then red. So this month you didn't have no eggs were fertilized, so they will go down one side of the fallopian tube, right? Okay. And the next month, it'll go down the other side of the fallopian tube. So it alternates months, so it doesn't release from the same fallopian tube every year. So sometimes women will have a problem with the egg will get stuck. That's an ectopic pregnancy when it actually gets stuck in the tube right there, right? And we can even have this tube blocked up, and then the eggs will release from the other tube as well. So that's a ectopic pregnancy. And that just means that the sperm and the egg met. They met in going up the fallopian tubes. However, it did not. It didn't work. It either stuck to the tube, or it just didn't grow. Okay, so my lovely sperm swim, 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 swim. Oh, it's the right time, right? There are eggs being released. Oh, eggs, 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 right? The sperm and the egg meet. Like right here, they've met. Yay, life is good. Okay, so then what's going to happen is the sperm and the egg, there's things called sela, like little bitty fingers that help the sperm go up, meet when the sperm and the egg meet. And then, if we're lucky enough, they will continue to grow and grow and grow and grow and actually land up in the uterus. Okay. So a lot of people like, oh, I don't know. We know that we do this part, that there's ejaculation. However, we don't know actually what happens up here. Okay, so that's kind of how it works. So that's a basic conception, and I know that's a lovely picture. So thank you, thank you. I know I'm an artist. So anyway, this article it talks about the dynamics of human development. Okay, so it talks about Jacques and Christine. They have a baby. They'll realize that children are fun, but it definitely changes their life. So here's what I talked about. Okay, so sperm meets egg, the child is conceived. It's not that simple. Conception is the time when you actually get pregnant, right? That is conception. Ovulation is when a woman is releasing eggs. You'll see now in the store, there's their ovulation kits, right? So you can tell when you're ovulating. A lot of my friends will be able to tell me that they know when they're ovulating, that their body temperature changes or they can feel like it. I was never able to do that, but a lot of people do say that they do. And remember, if we look at our Catholic population and many of our Hispanic families, they don't use um, a barrier method, not a condom, not any kind of medication. They use the rhythm method, where they're trying to count the days from their cycle. So that's many times they do know when they're ovulating. Okay, so I talked about the sela, those little hairy things that carry things up. So a sperm has gotten that far after ejaculation, the discharge of semen, it goes all the way up. Typical ejaculate has approximately 1 teaspoon, has between 20 and 400 million sperm. And you only need one. Imagine all that sperm. So, unlike females who are born with a finite number of eggs, like I said, we have the most number of eggs when we're born, and every month that we menstruate, we lose those eggs. Okay, men can father children up into forever and forever. By the time the sperm reaches the egg, it's swum like 3,000 times its own length, like swimmers, woo, right? All the sperm that are healthiest and most likely to fertilize the egg during the first 24 hours after ejaculation. They can survive up to 72 hours in a woman's reproductive tract. So that means, so maybe you're not ovulating today, and if there's some sperm swimming up there, you do have, there's still a possibility that you could get pregnant later on. Okay, so let's see here. The fallopian tubes, it tracks the sperm. It's called a zygote, right? Way back then. Eggs are not fertilized by the sperm, simply disintegrate, they go away. And that first time it develops, it is called a zygote. So each one has an X and a Y. Okay, I'm trying to find my eraser here. There we go. So each eggs contain an X, and the sperm becomes either an X or Y. So then, if we get an X, right? So if the egg fertilized with the sperm becomes an X, it's a female. Those with the Y would be a male. So later on, you will learn about intersex, and that term means people who are actually born with both genders. And certainly that can happen. Those things happen in utero, right? Okay, so just kind of so you have a good an idea of the basics of how babies are conceived. Okay, the diagnosis of pregnant. Back in the day, way before most of you were born, we would use this rapid test thing, right? We don't use that anymore. So what we're looking for is really the amount of HCG, that's human growth hormone. So that's how we know. So most people that women most often know when they miss their first period. That's usually about 5-6 weeks ahead, right? That's about 5-6 weeks. We can do a lab test. So most often the urine test is pretty accurate, but definitely the blood test is the most accurate. So many home pregnancy tests claim to be 99% accurate on the day you miss your period, although research suggests that many home pregnancies don't consistently spot pregnancy this early. So they're not always considered reliable. And if you know the importance of validity, I do need my test to be valid, right? I don't want to take a test that's not valid, because I can take the test over and over again and it tell me that I am not pregnant, and it really could be because it was an old test, because it wasn't valid or reliable. Okay. Although early home pregnancy tests can highly accurate, there's room for error. Like if you didn't follow it, if it's exposed to sunlight, accidental vibration, an unclean container, all of those good things can happen. but many of has definitely used a home pregnancy test. I always think those commercials should be real instead of like, "Oh, honey, we're pregnant." Ah, it should be like, "I'm pregnant," and throw it across the room and some tears. Okay, maybe that's just me. Sorry. So we're looking at the first trimester, right? That's the first 3 months. Okay, by the end of the first month, a primitive heartbeat and digestive system has developed. The basic initiation of the brain. The embryo begins to resemble human form. 3 months, the third month involves the hands, the arms, and the feet, fingernails, hair follicles, things like that. So 3 months, remember, so we're about 12 weeks, 12 weeks. Okay. So pregnancy is actually 10 months. So we divided that up into three. The baby is usually born at the end of the 10th month. Okay. In that first trimester, that's when women get that lovely morning sickness, right? The hormones change, your breasts get large and tender, you're peeing on yourself. And I remember being pregnant the first time, and I felt like this alien had taken over my body. But truly, you are you're supporting human nature, right? You're bringing life into this world. So your body definitely does adjust. The second trimester and the third trimester, let me just kind of show you some pictures of what that actually looks like. Many of you that have had babies or will have babies, you've looked at that book, like What to Expect When Expecting. Let me look at in utero. Let's see. Let's move my picture around and let's see. When in doubt, go to WebMD, right? Okay. Oh, get out of there. Okay, so let's look at this. So you're pregnant. Congratulations. So let's take a look inside the womb. Okay, so that's the conception. Remember that sperm? I think it looks just like the one that I drew, right? Maybe not. Okay, so fertilization happens when the sperm meets the eggs. It passes through the fallopian tubes into the uterus where it attaches to the urine wall, the placenta, then will actually begin to nourish the baby. Okay, 4 weeks, we looked at that. The heart and the blood vessels continue to develop. 8 weeks, that's 2 months. The baby is a little over an inch and a half. So 12 weeks, and now this is the end of that first trimester. Your doctor can hear the baby's heartbeat with special instruments. The sex organ of the baby should start to become clear. I don't want to give me another page. Come on. It's not going to give me another page. I think my screen is frozen here. I should close out some of my 1,000 million windows. That might help. No, really not. There's a great YouTube video right there. So if you want to go back and watch that link, you might enjoy that just to kind of get an idea of what the baby looks like. I like this one also. So people wonder kind of, what it actually looks like. A lot of us have had babies and really didn't understand the anatomy. We've read the books, and sometimes the doctors will tell us things, but we're like, what? What does that mean? So I can make that a little bit bigger. Okay. So again, that's what that baby's going to look like. So the amniotic sac, that's the fluid that protects the baby. The cervix, so that is where the baby is going to come out. So your cervix really is usually very tight, right? However, your cervix then gets bigger and bigger and bigger to have the baby release. It doesn't stay that way. The cervix does go back, right? I talked about the egg and the fertilization. The fetus is the term for for the unborn baby from the 8th week. Prior to that, the term is zygote. Okay, sperm, umbilical cord. The umbilical cord is attached to the placenta, and that is where how babies live. So whatever you eat, whatever you ingest, mom, it will go in through your digestive system. The baby gets it through the placenta. Okay. So the umbilical cord is actually the placenta and the umbilical cord are actually not attached. So if you were there ever, we were able to cut the cord. So the cord is attached to to the placenta. So many times after mom delivers the baby, she has to push a couple more times to actually push out the placenta. So it's not actually attached to mom like we kind of sometimes think. It's attached to the placenta. Okay. So again, just kind of give you some questions, ideas of what that looks like. Okay. So go back to our information. Waiting for it to load. Okay. So prenatal assessments, right? So those are when we're looking at the baby while still in utero, an ultrasound, a sonogram, a fetal MRI, amniocentesis, all of those lovely things. I can tell you I had an amniocentesis. I was an older mom with my last child. I was 38. So after 35, you're considered high risk. And what we know is that babies who are later with mom or dad are at greater risk for many times some of the cerebral palsy and things like that. So they actually sit a needle inside of your uterus. They grab some of the placenta, right? That is the baby is swimming in, and they test that. So that is how we know many times if there's some abnormalities in brain development before the baby is born. Now we have these wonderful lifelike, procedures so that you can see the baby. I'm old, so my kids didn't have that. But so amniocentesis can look for muscular dystrophy, cement spina bifida. Also, the gender of the baby can be determined at that age. Okay. And like I said, anybody over 35 is at a higher risk. So CVS is another way. It's a thin plastic tube through the uterus. It's going through that way. Okay. And it's again looking for any genetic abnormalities. Okay. Those of you who've been around moms or have had moms, this is probably a reminder to you. But for those who have not, this is the first part of normal human behavior. Behavior goes to conception all the way out to death. Okay. So then, like I said, an ectopic pregnancy, it's a tubal pregnancy. The egg and the sperm have met, but didn't quite make it up to the uterus. Okay. So current rate of ectopic pregnancies has drastically increased from what it was 30 years ago. Okay, and this is from 2014. So they think that it may be attributed to a raise of an increase in STIs that causes scar tissue in your tubes, right? So then the eggs and the once the placenta and the egg meet, they don't have any place to go because of the scar tissue. Toxemia is also called preeclampsia. Excuse me. Preeclampsia, it can be deadly to the baby. So mom gains lots of weight. There's lots of fluid on there. It really is hypertension, high blood pressure. It's much more higher in African American women that RH incompatible. So that has to do with the blood. So when the babies are born, if they're carrying dad's blood type as opposed to mom's, then sometimes when it comes to breastfeeding, it's incompatible. Okay. Again, those are your terms that you'll need to go. Okay. So what we always look for is normal developmental milestones. And what that means is when I'm working with a family, I'm looking back with the child. Did he walk? Did he talk at the right age? Did he do what he was supposed to? Because if I've got a 10-year-old and I realize he didn't walk till he was 4, then I realize there's something else going on. So the major milestones we're always going to look at. Okay. Growth is considered to be continuous, orderly process. Okay. So these things happen. The baby smiles, the baby recognizes faces. So those are continual, orderly process. So behavior, human behavior growth is continuous. Of course, that nature versus nurture controversy, that's one that's been around forever and forever. So, for example, when we talk about nature versus nurture, we're looking at, where did that come from? So, I can say that the color of my skin and the color of my eyes, definitely, those are a nature thing, those are genetic. Sorry about that. However, when it comes to temperament or personality, are those genetic or did I learn them? Right? And later on, we talk about drug and alcohol abuse, where we're going to look at that as well. Is it nature? Am I predisposed to be an alcoholic because of what my dad did? Or is it because I was raised in that environment? Okay. So that's the nature versus nurture. So um, I am, my kids have done very well in school. Is it because mother did very well or because of the environment they were raised in? So when your mother's a college professor, you know from day one you're going to college. You know from day one that you're building your resume and all of those things that you need to get to college. So is that genetic or is that the environment or a combination of the both? That's what that means. Okay. Okay. So again, profiles of normal development for children age 4 months to 11. Okay. Again, so at 4 months, babies should be holding their head up at a 90-degree angle. They should watch their hands, keep their fingers busy. They like to play with their feet. They realize they have feet and put the feet in their mouth. They're able to recognize their bottles. The sight of a bottle often stimulates bodily activity. It's kind of like me when I see food. I'm like, yay, yay. Exactly. So sometimes teething begins at this age, but if it doesn't happen until 6 or 7 months, that's really fine. Babies begin to recognize their mother and other familiar faces. 4 months old, they should be babbling. They should be making some sounds, some cooing, some something sounds. So if you're doing a home investigation or a home visit or a client comes into your office and the baby is 4 months old and he's not able to raise his head and he's not able to flip over and he's not making any sounds, we're concerned, right? We're concerned. So you might want to say to the mother, have you discussed this with your pediatrician? So we're not in the medical profession, but I do recognize normal behavior enough to be able to send them to their pediatrician. Okay. 8 months, they can sit alone. They're able to assist themselves to a standing position. They begin creeping on all fours. Some babies, of course, skip that crawling stage and go straight to walking. So if a baby is not crawling at 8 months, we're not as concerned. We are looking for some movement, though, maybe some scooting, things like that. They like to bang toys together. They can begin to feed themselves. They love peekaboo. They love peekaboo. And remember, at this point, according to Piaget, they know the ball is still there. So semi-permanence, um, uh, concrete. So that permanence knows that the baby, they look and wait, he's still there. Prior to that, before they were there, they really thought the ball was gone. They closed their eyes, they couldn't see the ball. They thought, oh my gosh, it's just gone. So object permanence develops about 6 to 7 months. So now they're going to look for the ball. And again, they should be babbling. Maybe those few words, sorry, dada always happens first. It's those letters, the consonants are easy to say, but dada and mama should happen at those age. By 1 year. Okay. So we're really not concerned if they don't walk totally until they're about 18 months. They may need to require support to walk. They can still be able to stand alone. Okay. A 1 year old likes to examine toys. They move around, they put things everywhere, they put things in their mouth, but they should be able to drink from a cup by a year, right? Okay, and so the socials, they really like to be around others. So that is my 1 year old. Now, by the time they're 18 months, we do expect babies to be walking. So if they're not walking at this age, again, you have a client in your office and you're like, hey, you notice that baby is not walking, then I'm concerned, right? That's one of those things that I'm going to really go back to the pediatrician and say, hey, wait a minute, what's going on here? What's going on here, right? Be able to feed themselves by 18 months. They can cooperate in dressing. They may not like what you picked out yet, especially when we hit those lovely twos. But at this month, by 18 months, they should have more than three, but less than 50 words. Okay. So basic things, boy, girl. One of the things we actually know is babies learn the terms for items that move faster than they learn the things that are stationary. So, dada, mama, because they move, cat, dog, ball, things that are moving that makes babies actually learn those words faster. Okay. And then by two, they can walk and they can run. 2 year olds, the 2 year olds are very interested in exploring the world. They like to play with small objects. They explore the texture. Okay, 2 year olds enjoy looking at books. It is normal for a 2 year old to play by himself. We are not thinking autism if he is playing beside another child. Okay, so the thought of playing with someone else doesn't come along till later. Piaget would say this is egocentrism, that they're really it's just all about me. So don't be concerned if this for two he's playing alone. What we're concerned about autism is we look at babies that are having some unusual behavior, playing with cars that are stacking the cars instead of driving the cars, difficulty with changes. And now, of course, it's ASD, it's on the spectrum. Okay. So 2 year olds can usually put 2 to 3 words together. Daddy gone, want milk. So we really think a 2 year old should have this. The vocabulary includes more than 50 words. We're looking for most children to have about 200 words at 50, not necessarily I'm sorry, at two, not necessarily making full sentences, but having 200 separate words: dog, cat, son, no, yes. Okay. My lovely 3 year olds can walk well and also run a steady gait. A gait is the way that you walk or run. So when you're little, kids are kind of like falling. If you're inebriated, your gait may not be steady, right? But that's what that means. They're three, and their gait is pretty quickly. They can run, stop, and turn. They can go without falling. Many times we're putting our kids in sports at 3 and 4, right? Okay, at three, it's their imagination. They are actively helping in dressing. They can put their own clothes on. They can begin to use a fork. They can get a glass of water. Okay. So by the age of three, children can use a toilet by themselves, but they often might need help. So what we know is full potty training is not expected until kids are the age of three. So I know that Mom and them and somebody else said if they're two, they should. But what we know is we are not worried if children are not potty trained by the age of three. Okay, and I know in daycares, they say the kids have to be in underwear by the time they're three. However, it's okay if they have accidents. And one of the interesting things is that the incidence of abuse happens much more likely around potty training. When the belief is that someone told me he's two, and most of the time he goes all day without an accident, and then he has an accident, and I freak out, or the husband freaks out, or the boyfriend freaks out and beats the child. So make sure that you understand that when you're working with families, we do not expect babies to be potty trained till three. If they're potty trained at 18 months, great. Or two, great. It's great. But don't be concerned. And when people say he's almost 3, he's not potty trained, tell him that biologically he's really not ready. That sphincter muscle, that's the one that, holds your potty, right? It's not fully developed until they're the age of 3. Okay. We don't diagnose, pull those up, when babies pee on themselves or poop on themselves. It's called encopresis or enuresis. Now, so usually it pulls up right there. Okay, so encopresis is pooping on yourself, and enuresis happens when you pee on yourself. Okay, so encopresis usually happens after the age of 4. So we're not worried that a baby is having accidents until they're almost 5. So if you've got a 5-year-old that is having trouble holding their bowels or not having accidents, then we're worried. But remember, and this is really important as you're working with families, don't expect that baby to be potty trained. And I do realize sometimes you're going against everything you've ever heard growing up, right? And you've gone to social work school and now you're coming as the expert. Facts are facts. Facts are facts. Remember, we work from an evidence-based practice based on what research says, not what my mom did or not what happened or not what I've been told. Okay? Age of 4. Okay, so those are my lovely preschoolers. They are creative and imaginative. The 4-year-olds tend to be very assertive. They can dress themselves. If this were a Piaget stage, that would be 3 to 5, and he would say that they are in the preoperational. I'm sorry. Erickson would say 3 to 5 that they are in the stage where they show initiative. They're trying to do things. They want to be the big kids. Okay, so they can be assertive. They usually can dress themselves. They can use the fork and the knife. 4-year-olds are less docile than 3-year-olds. That means they're beginning to grow up, and they're going to ask mom questions. Go to bed. Well, why? I don't want to go to bed. Their language is growing very quickly, right? Their vocabulary grows tremendously at this part. And remember, at this time, most kids or many kids are starting preschool. Okay, 5-year-olds, again, 5-year-olds are quieter and less active than 4. So we're starting preschool this time or kindergarten. Okay, so they play games with each other. They're more elaborate team game begins. 5-year-olds can dress themselves, of course. Okay. Language gets bigger and bigger and bigger. So they're really growing up, that your little baby is actually grown up. 6 to 8 is those elementary school years, right? We're starting there. They can really become that motor coordination happens really quickly. If you were looking at a Erickson viewpoint, he would say at this age, that is where they learn what they're good at. That's their competency, right? So I'm a good basketball player. I'm a good student. I'm a good something. So Erickson said, if you don't figure that out in these early years, that you won't know what you're doing later. Okay. 9 to 11. Okay. So then we're starting to get into some boys and girls who are looking at going through puberty, right? Okay. So as we look at those will be issues in our next chapter as we're going through. So this is the biological development of children. This talks about abortion. Okay. So this abortion to terminate a pregnancy, and depending on what state you're in, is the law of whether or not you can. So most states still allow a woman to have an abortion up until the age of viability, which now is about 23 weeks. Okay. So in social work and counseling, we don't get to decide. If someone comes to me and they said they want an abortion, my job is to support their decision. My values, my beliefs play no role in that client's life, none whatsoever. So I'm going to lay out the options, and whatever she chooses, my code of ethics says I'm going to be supportive of her. Okay. Remember, your values do not play a role. You don't get to influence someone's life or mess up someone's life because it's not the right choice for you. Okay. People come to you who are needy. They're lost. They're not sure what to do. So a woman who is pregnant, no matter what the situation, just deciding or talking about an abortion is not an easy choice. They don't need someone telling them that they're wrong. What they need is someone who is supportive, and support their decisions and give them the information that is needed. Okay. Okay. We talk about the difference between micro and macro. And of course, micro is my family's, macro is the community. So when it comes to human behavior in the community, I think recently the Supreme Court did not act on in Texas. So Texas has said that you can't have an abortion after after the fetus is 6 weeks. And for most people, they don't know they're even pregnant until they're 6 weeks along. So it did go to Supreme Court. The Supreme Court did not take a stand either way. So currently, that is a law in Texas. However, Roe v. Wade has been the standing law, that said that women can have an abortion. Okay, so but many states have gone back. That was a federal decision. So many states have gone back and looked at that at the state level. Roe v. Wade overruled state laws prohibiting or restricting a woman's right to an abortion during the first 3 months of pregnancy. States were allowed to impose restrictions in the second trimester only when restrictions were related directly to the mother's health. Okay, so those are kind of the story of Roe v. Wade. I read an article one time about a mom who, this was her third child, and she was 7 months pregnant. And at 7 months pregnant, she realized the ultrasound had determined that the baby would be severely disfigured. And she and her doctor decided, and that this is not her first child, and she was an adult, decided that this would not be a good choice. And the state she lived in, the article said that abortion was against the law at that far along. One second. So she went to a different state and had the abortion. um, Medical decision, not I don't want this baby, just a very tough medical decision. And the article talked about how she just told people she had a miscarriage. And she really felt that she couldn't tell people that she had an abortion, no matter what the reason was. She just really felt people would judge her. And remember, we don't get to do that. We don't get to do that in this profession at all. We are non judgmental. We are supportive. While that may not work for you or it may not work for me, this is what works for my client. And one of the things that makes us good social workers is empathy. Empathy is really being able to put myself in that client's shoes, excuse me, while she made that decision. Okay. And again, imagining what she was going through of planning a baby and expecting a baby and wanting this so much and realizing that this wasn't what she had planned. So again, no matter what your views are, they don't really matter in this field. And if you find that your views are so strong, you might be in the wrong field. I will say that some people say, well, I'll just won't work with pregnant women. That's really not possible, right? Because no matter what clientele you work with, you're going to find a woman who's pregnant. That's hospital, prison, child abuse. No matter what you're doing, you're going to find a woman who's pregnant. So again, check your value system. And again, what may be right for you and your family is fine, but it's not right for you to talk about what happens in other countries or, other families. Okay. This talks about the incidence of abortions, and we always think, oh my gosh, it's those kids. But what we find is between 20 and 24 and 25 and 29, that's where the majority of abortions come in at. Okay. And if we look at the previous, so most people that have an abortion, this is their first time. We hear these stories on social media that women use birth control use abortions as birth control, right? They just get pregnant, get rid of it. Research does not support that. So in this profession, remember, we need if you're listening to news sources, listen to more than one source. Okay. Or better yet, do research yourself. because whether you're left or right, and I'm not taking a political stand, all I really care about is the scientific facts, the evidence-based facts that help my client. I don't want to tell her what I heard on CNN or what I heard on Fox. That's not going to help me because we know that the news is really about gaining viewers, right? Can make this story sensation, so our numbers will go up. I want to give my students, my clients, factual information so they can make the best choice for their lives. Okay? Unplanned pregnancy, accidental pregnancy, rape, incest, all of those things are reasons for having abortion. 3/4 of women cite concern for responsibility to other individuals. 3/4 say they cannot afford another child, and 3/4 they said having a baby would interfere with school, work, or the ability to care for their dependents. And half say they didn't want to be a single parent. Okay, so when I looks at my reasons for pregnancy, that's what we look at. No one desires to have an unwanted pregnancy that ends in abortion. No one woke up and said, "Oh, let me go get pregnant so I can have an abortion." No, right? No, that is never the plan. Never, ever the plan. So, again, we want to make sure that we are just supportive of our clients. Whatever their decisions are, we are there to support them. Talks about the different methods of abortion, so be sure that you guys go back and read those. These are the arguments and against and for abortion, right? So permitting women to obtain abortion corresponds with the principles of self-determination. That's what we believe in the mental health field, right? Clients have the right to make those decisions. If abortions were prohibited, women would seek illegal abortions like they did in the past. And I don't know if you've seen any of the movies or had any of your grandparents talk, but abortions have gone along for a while. Things like using coat hangers, using a knife and things that really cost women their lives. So making it illegal hasn't stopped it. One of the other things is um, making abortion illegal disproportionately affects people of lower socioeconomic status. Okay, so let's say that Texas has changed that law, and now you can't. After 6 weeks, I can't have an abortion. If I'm married and I have a husband, and we both have two incomes, I can just go to the next state over, right? I can pay for it. If I am, 20 and I already got one child and my husband isn't working, going to the next state to pay for it maybe isn't an option. So, as a counselor, as a social worker, my concern is social justice, making it safe for all women. Okay. If abortions were prohibited, some women would attempt to, again, self-induce abortion. We've heard those stories. Okay. No contraceptive method is perfectly reliable. I know, right? That there's nothing that's 100% other than abstinence, which sounds great if you're 15 or 16, but what if you're married, right? So, though sometimes it is unplanned. And again, I've always told my daughters that I don't want a mistake in 15 minutes sometimes in the back of a car to change their whole lives. So that's how I feel. The people who support abortion say the right of the fetus is the right of to life is basic and it should not be infringed. They believe it's an immoral based according to the Bible. A woman who chooses to have an abortion is selfish. She prefers her own pleasures over the unborn child. And in a society where contraceptives are readily available, there should be no unwanted pregnancies. Okay. And people supporting abortion are anti family. People should take responsibility for their behavior, cease non marital sexual intercourse, and bear children within a family context. So, those are the pros and cons. And again, we're not taking sides, we're just supporting our clients. Okay. And again, we're going to talk about empowering women, ethical issues empowering women, the issues of infertility. Go back and read this chapter as well, guys. The many causes of infertility, the psychological reaction, not being able to have children. Okay. So I've covered major things in this chapter. So I just wanted you guys to get a head up of chapter 2, and this is that chapter based on conception. Let me go back to that chapter. Okay, so this was again chapter 2. So, and there are some ethical questions in there if you're in my class to go back and answer. Okay, so I hope you're able to engage disengage. And this is an ethical question. So, should a pregnant woman who consumes illegal drugs that damage her child be punished as a criminal? Should the child be taken away from her? If so, with whom should the child be placed? And that definitely is a loaded question. So, for the test and in social work world, babies don't count until they're born. Until they have a social security number, the mom is my client. And currently, the law says I cannot report mom because she has a drug issue. Okay. I can make a report. The police, the hospital can make a report once the baby is born. Okay. So, and in most states, that is illegal. Right? So then there, many times the babies are taken away. Mom is putting in drug rehab, all of those things. So share your opinion, but I'll let you know just the facts. The fact is the baby does not count. And for according to Code of Ethics, according to the test, the LCSW test, our belief on from social work or mental health counseling, our belief is that it doesn't count because we're looking at billing, right? Who do we bill? We can't bill a baby that doesn't have a social security number yet. So we're always looking at who is my client. Okay. So just to kind of look at some of those questions, guys. So this was chapter 2. I'm going to wrap you up. Of course, there's a test, a quiz at the end of this chapter. So we will start next week, of course, on chapter 3. I will be back in class and we'll be doing synchronicity on chapter 3. Okay, so those are your responses. Remember, you can do those at any time, guys. Let me go back. Okay, so next week we're looking at chapter 3, which is the psychological development of infants. And again, we'll talk more about those questions like Piaget and Erikson and all of those kind of theorists that are important for us to know. Okay, guys, it's been a pleasure. I certainly hope that this chapter 2 of human behavior made a difference to you. This is a lot of information, a lot of information. I will tell you for my current students, many of these things are on the test, whether it's the mental health test, the LPCs, the lost professional counselor, the NADAC, the drug test, or the social work test. Many of these items are on the test. So keep your study material, keep your notes. You'll need those when you take the test. Okay? It's been a pleasure. It's been a pleasure. It's been a pleasure. Hope everyone has a wonderful, wonderful weekend. And I'm going to end this video. Bye, guys.